Good day, sir. Today my group mates are gonna relate the movie entitled Daredevil that is directed by Mark Steven Johnson from our topic that is consists of the sense of hearing and the sense of smell. This is gonna be discussed by Jacinto and my fellow group mates.
Hearing loss that occurs gradually as you age, or presbycusis, is common. Almost half the people in the United States older than age 65 have some degree of hearing loss. Hearing loss is defined as one of the three types. Conductive involves outer or middle ear, sensorineural involves inner ear, and mixed combination of the two. Aging and chronic exposure to loud noises both contribute to hearing loss. Other factors, such as excessive earwax, can temporarily reduce how well your ears conduct sounds. You can't reverse most types of hearing loss. However, you and your doctor or a hearing specialist can take steps to improve what you hear. The parts of the ear is made up of three primary parts: the outer ear, middle ear, and inner ear. Each section is composed of structures that play distinct roles in the process of converting sound waves into signals that go to the brain. Outer ear. The outer ear is composed of the visible part of the ear, pinna, and the ear canal. The cup-shaped pinna gathers sound waves from the environment and directs them into the ear canal, while the middle ear is an air-filled cavity that holds a chain of three bones: the hammer, the anvil, and the stirrup. These bones are separated from the outer ear by the eardrum, which vibrates when struck by a sound wave. The middle ear is connected to the back of your nose and upper part of your throat by a narrow channel called the auditory tube. The tube opens and closes at the throat end to equalize the pressure in the middle ear with that of the environment and brain fluids. Equal pressure on both sides of the eardrum is important for normal vibration of the eardrum. Bones of the middle ear contains three tiny bones: hammer attached to eardrum, anvil in the middle of the chain of bones, stirrup attached to the membrane-covered opening that connects the middle ear with the inner ear. The vibration of the eardrum triggers a chain of vibrations through the bones. Because of differences in the size, shape, and position of the three bones, the force of the vibration increases by the time it reaches the inner ear. This increase in force is necessary to transfer the energy of the sound wave to the fluid in the inner ear. The inner ear contains a group of interconnected fluid-filled chambers. The snail-shaped chamber, called the cochlea, plays a role in hearing. Sound vibrations from the bones of the middle ear are transferred to the fluids of the cochlea. Tiny sensors or hair cells lining the cochlea convert the vibrations into electrical impulses that are transmitted along the auditory nerve to your brain. This is where the initial damage and hearing loss occur due to age, noise exposure, or medication. The other fluid-filled chambers of the inner ear include three tubes called the semicircular canals or vestibular labyrinth. Hair cells in the semicircular canals detect the motion of the fluid when you moved in any direction. They convert the motion into electrical signals that are transmitted along the vestibular nerve to the brain. This sensory information enables you to maintain your sense of balance. Traveling to the brain, electrical impulses travel along the auditory nerve and pass through several information processing centers. Signals from the right ear travel to the auditory cortex located in the temporal lobe on the left side of the brain. Signals from the left ear travel to the right auditory cortex. The auditory cortices sort, process, interpret, and file information about the sound. The comparison and analysis of all the signals that reach the brain enable you to detect certain sounds and suppress other sounds as background noise. Signs and symptoms of hearing loss may include muffling of speech and other sounds, difficulty understanding words, especially against background noise or in a crowd, trouble hearing consonants, frequently asking others to speak more slowly, clearly, and loudly, needing to turn up the volume of the television or radio, withdrawal from conversations, avoidance of some social settings. How hearing loss can occur. Causes of hearing loss include damage to the ear. Aging and exposure to loud noise may cause wear and tear on the hairs or nerve cells in the cochlea that send sound signals to the brain. When these hairs or nerve cells are damaged or missing, electrical signals aren't transmitted as efficiently and hearing loss occurs. Higher pitched tones may become muffled to you. It may become difficult for you to pick out words against background noise. Gradual build-up of earwax. Earwax can block the ear canal and prevent conduction of sound waves. Earwax removal can help restore your hearing. Ear infection and abnormal bone growths or tumors in the outer or middle ear. Any of these can cause hearing loss. Ruptured eardrum or tympanic membrane perforation, loud blasts of noise, sudden changes in pressure, poking your eardrum with an object, and infection can cause your eardrum to rupture and affect your hearing. Risk factors that may damage or lead to loss of the hairs and nerve cells in your inner ear include aging. In aging, degeneration of inner ear structures occurs over time. Loud noise. Exposure to loud sounds can damage the cells of your inner ear. Damage can occur with long-term exposure to loud noises or from a short blast of noise, such as from a gunshot. Heredity. Your genetic makeup may make you more susceptible to ear damage from sound or deterioration from aging. Occupational noises. Jobs where loud noise is a regular part of the working environment, such as farming, construction, or factory work, can lead to damage inside your ear. Recreational noises. Exposure to explosive noises such as from firearms and jet engines can cause immediate, permanent hearing loss. Other recreational activities with dangerously high noise levels include snowmobiling, motorcycling, carpentry, or listening to loud music. Some medications, drugs such as the antibiotic gentamicin, sildenafil, and certain chemotherapy drugs can damage the inner ear. Temporary effects on your hearing. Ringing in the ear or hearing loss can occur if you take very high doses of aspirin, other pain relievers, anti-malarial drugs, or loop diuretics. Some diseases or illnesses that result in high fever, such as meningitis, may damage the cochlea. Cause and risk factors. Hearing loss can happen anytime during life, from before birth to adulthood. Following are some of the things that can increase the chance that a child will have hearing loss. A genetic cause. About 1 out of 2 cases of hearing loss in babies is due to genetic causes. Some babies with a genetic cause for their hearing loss might have family members who also have a hearing loss. About 1 out of 3 babies with genetic hearing loss have a syndrome. This means they have other conditions in addition to the hearing loss, such as Down syndrome or Usher syndrome. Next, 1 out of 4 cases of hearing loss in babies is due to maternal infections during pregnancy. complications after birth, and head trauma. For example, the child was exposed to infection such as before birth, spent 5 days or more in a hospital neonatal intensive care unit, or had complications while in NICU, needed a special procedure like a blood transfusion to treat bad jaundice, has head, face, or ear shape or formed in a different way than usual, has a condition like a neurological disorder that may be associated with hearing loss, had an infection around the brain and spinal cord called meningitis, received a bad injury to the head that required a hospital stay. For about 1 out of 4 babies born with hearing loss, the cause is unknown. There are 4 types of hearing loss. Conductive hearing loss caused by something that stops sounds from getting through the outer or middle ear. This type of hearing loss can often be treated with medicine or surgery. Sensorineural hearing loss that occurs when there is a problem in the way the inner ear or hearing nerve works. Mixed hearing loss that includes both a conductive and a sensorineural hearing loss. Auditory neuropathy spectrum disorder, hearing loss that occurs when sound enters the ear normally, but because of damage to the inner ear or the hearing nerve, sound isn't organized in a way that the brain can understand. For the degree of hearing loss can range from mild to profound. Mild hearing loss, a person with a mild hearing loss may hear some speech sounds, but soft sounds are hard to hear. Moderate hearing loss, a person with a moderate hearing loss may hear almost no speech when other person is talking at a normal level. Severe hearing loss, a person with severe hearing loss will hear no speech when a person is talking at a normal level and only some loud sounds. Profound hearing loss, a person with a profound hearing loss will not hear any speech and only very loud sounds. Hearing loss can also be described as a unilateral or bilateral. Hearing loss is in one ear, unilateral, or both ears, bilateral. Prelingual or postlingual, hearing loss happened before a person learned to talk, prelingual, or after a person learned to talk, postlingual. Symmetrical or asymmetrical, hearing loss is the same in both ears, symmetrical, or is different in each ear, asymmetrical. Progressive or sudden, hearing loss worsens over time. Progressive or happens quickly, which is sudden. Fluctuating or stable, hearing loss gets either better or worse over time. Fluctuating or stays the same over time. Stable. Congenital or acquired or delayed onset, hearing loss is present at birth, congenital, or appears sometime later on.